get his input on this as this affects me personally. But sheriffs want lists of patients using painkillers, and the state of North Carolina, the State Sheriff's Association in North Carolina wants access to state computer records identifying anyone with prescriptions for powerful painkillers and other controlled substances. Now, of course, we know that this opens the door to so many different things, and it also brings up the subject of pre-crime. And we've noticed over the years now how pre-crime is being pushed and pushed and pushed more and more, much akin to 1984, George Orwell's novel. And I wanted to know from a doctor's standpoint, Dr. Waterman, how much has the government intruded into the doctor-patient relationship, so much so to the fact that, at least from my standpoint and dealing with my wife who happens to be disabled, we've noticed that it's so bad that doctors are actually afraid to treat their patients. Do you see that in the medical community?
That's an understatement, Joe. Let me give you a couple of figures here, and then I'm going to give you a personal experience I've had.
Wonderful.
Doctors are, by and large, some good folks, although they are brainwashed. Now, I might also say that I was a professor of pre-med and nursing in Michigan, and I can tell you that they're hungry for the options. But what's going on is that only 17% of the medical profession in America belongs to the American Medical Association. And the reason, they don't represent the standards and the desires and the needs of the medical profession. But we don't hear about the other professional organization, which has even a larger presence. Now, that kind of surprises a lot of people, that only 17%. And they say, well, why do these doctors continue to do the things they do? Here's why. Because under the laws of the profession, they have to abide by what's called the golden standard of care. If they get outside of the golden standard of care, they get their hands slapped. And the golden standard of care is not so golden. It's broken. The existing medical model is completely broken. Absolutely, completely broken. Now, when it comes to what they're trying to get doctors to do, let me give you a personal experience. It's been about 2.5 years ago. I was co-located, not partnered up with, but we just had the same building and shared suites and so forth with another doctor. And in the mail one day, he came into my office and he says, looky here. And he showed me this piece of paper from the federal government that said that they wanted all the doctors to register so they could implement an electronic system. And this was about 3 years ago, I should say. Mm-hmm. Now, what we did with that paper was throw it in the round file.
Very good.
Well, we probably should have kept it because we didn't know how important it was going to be, because, now this kind of thing was going, pretty widespread, talking to other colleagues about what was going on. But here's what was going on. They are preparing to put a device much like a credit card machine in the office, so that when they attempted not too long ago to pass this health care stuff, they wanted to make sure you had an ID. That was their first attempt. That backed off. They backed off that national ID, if you recall, in 2008. Well, that was going to be used to make sure that when you went into a doctor's office, the doctor had to swipe the card in order to get permission to see a patient. And if he submitted care and did work and submitted it to insurance and it wasn't approved first, he could lose his license. That registration was already, the federal government was already beginning that far back. And I'm sure that many of the other doctors did pretty much what our offices did, because we didn't have to do that. Every state has its own licensure laws. And this wasn't coming from the state. In other words, there was an agenda from the federal government to try and take over the states as far as their medical malpractice, their medical practices, not malpractice.
Mm-hmm.
So that attempt to get the information about patients, and it was underneath a law that was passed about the electronic information. That's about the time the HIPAA stuff came out big time, and so you were having to get all these compliant. And here's the bottom line: it's none of their business what the doctors and the patients talk to each other about. It's none of any government's business, not even the state. It's none of their business.
I agree.
And if they want to know something, they need to go to court. They need to take the regular avenues. Everything that they've done, they being the government, in this arena since the inception of the AMA and since the takeover by the big pharmas, which is persistent since World War II, has been nothing but to take away our health freedom and to create a system of constant sickness in order to treat it. That's really what they've been trying to do.
And like I said, from a personal standpoint, I know that we've been to doctor after doctor after doctor after doctor after doctor, and there hasn't been any help. And the reason why there's no help is because my wife's a liability to them. Because what happens is they see a case like hers and they say, oh man, we got the feds breathing down our neck, the state's starting to do stuff, and furthermore, for the record, since when or how is it that agencies like the DEA can come in and tell doctors how to prescribe things to their patients? Especially when you talk about, like, for example, opioid pain medication, stuff like that happens to be one of the safest painkillers out there. And it's got a stigma because of the people that abuse it. But these poor people that suffer with chronic pain suffer even more, and horribly so, because they can't get treated adequately. And that's the problem that we're running into, and I see it constantly. My wife's a member of a couple of chronic pain message boards and participates in some of that, and in contact with a lot of people that deal with this. And I can't tell you how many times that she's gone and talked to somebody one day and the next day they're gone because they've blown their brains out. Because at that point they have nothing else to live for. If they can't get treated and their quality of life is zero, and all they know is constant pain all the time, it really gets down to, boy, they've really just taken away, which kind of leads into Agenda 21. It is exactly what they want to do. Here's a group of people that is technically a drag on society. Now let's get rid of them. And that's the way I feel, is they're being bumped off. I don't know how you feel, Doc, but I certainly feel that way.
Well, the entire agenda is not to cure people or to get people past the need of the big pharma industry and, of course, the doctors. It's to get them hooked.
Right.
Another thing that makes them money is that, right now they're going to a government-based health system. I've already drawn the line there. It's not going to happen in my world, personally nor professionally. And I had to go get my Griff would be able to. We've talked a little bit on the side, and I had to go get some glasses, Griff, the other day. I wasn't able to see as good as I used to. It seems like I'm getting older here. And all my efforts that I've taken alternatively now. That's not to say that I haven't done well in other areas, but I went to see a colleague about my eyes. And we were chatting, and he says, he had a fellow that he talks with too, and he says, gosh, I'm not even going to be able to see my family physician, and he's a doctor. He says, because of this new law, and he asked this doctor why, and he says, because of what they've done, I'm going to have to hire 9 nurse practitioners, and he says, don't expect to see me except maybe every 2 years. So they aren't improving the program where you have access to the medical profession. Supposedly, this guy with an MD behind his name is supposed to be taking care of you, but the government has made it impossible for that to happen now with what they're doing in this new change, and now you're not even going to have access. We're going to have, well, we don't want to get into that. I could just go on for hours. The care is going to go away. But Agenda 21, that's just the medical front is just one of the fronts in war. In this, basically, Agenda 21 is an outline of war on all fronts. And you can just talk about, the basis of it probably, I guess you could say, is in property rights, where they think they can own the world and tell you what to do with it. And, what government in the world has ever done a good job of anything? I mean, it's like Will Rogers said, it's a good thing we don't get all the government we pay for.
That's right. That's absolutely right. I often challenge people all the time. I remember getting into an argument with one of my fellow engineers, and of course, one of the things that he would say is, well, that bailout, it needed to happen. It needed to happen because if it didn't, then everything would have come crashing down. It would have come crashing and burning and everything else. And, I had to say out loud, you're an idiot. And let me explain why you're an idiot. Because when you go and say, take a corporation such as GM, and you nationalize it, you name me one thing that's been nationalized in the United States that's been nationalized with success, with a track record of success, that hasn't been run into the ground. I said, I challenge you, find one thing and get back to me. Let's go ahead. And, of course, he can't. Social Security, bankrupt. Medicare, bankrupt. I could go on and on, but those two things, those are the big two things right there that just show that, they just run things into the ground. Everything. And really what happens is, what's supposed to happen in our country is when you are a public servant, and that's what you are, a public servant, you serve the people, you're supposed to be vanguards, good stewards of the people's money. And if you're not going to be a good steward of the people's money, then what are you? Well, you're complicit and you're an accomplice to a crime. Because you're wasting the people's money, it's a fraud, it's abuse. And that's what we're going on. But you notice that over the years what they've done is they've systematically programmed people by giving them things, by giving them what they call free things and subsidies and entitlements. And that's where we are now. So much so, people are so addicted to these things that we don't have a public that wants to step out and say, this far, no farther. Now it's just a very vocal minority. And it really, truly makes me sick. It really makes me sick. And John King, what do you think about that? What do you think about where we are now as a country?
Oh, well, I truly do believe that our founding fathers, the men that founded this country and wrote the very Constitution that we all love and hold so high, I think if you dug up Benjamin Franklin or Thomas Jefferson and threw a magnet on the heel bone and threw another magnet on their skull, you would create some sort of alternative energy that you'd be able to power the U.S. with. Those boys are spinning in their grave like a out-of-control top. I'm convinced of it. We are so far away from the original Constitution, I might as well call you comrade.
That's true. And it's like you say, Griff, the Constitution is really nothing more than a piece of paper at this point because they just totally disregard it.
Yes, they do, and they will continue. Their agenda, or the Washington Obama agenda, is to bring the country down. They don't give a damn about the Constitution or the American people. They've demonstrated that again.